Ever had a thought that just wouldn't leave you alone? A nagging worry that circles endlessly in your mind no matter how hard you try to shake it off? Now imagine that, but it's a whole factory of worries, non-stop, about everything. A 24/7 production line churning out anxieties, big and small, real and imagined. The machines are always running, the gears are always grinding, and the output is a constant stream of what-ifs and worst-case scenarios. It's like your brain's threat detection system is stuck on high alert, constantly scanning the horizon for danger, even when there's nothing there. The alarm bells are ringing, the lights are flashing, and the sirens are wailing, all for a perceived threat that may never materialize. Convinced everything is a disaster. Every minor inconvenience is blown out of proportion. Every small setback is seen as a sign of impending doom. It's a constant state of heightened anxiety where even the smallest things feel like a crisis. This is Generalized Anxiety Disorder, or GAD, a condition that affects millions of people worldwide. A relentless, exhausting loop of worry. It's like being trapped on a hamster wheel, running faster and faster but never getting anywhere. The worries just keep spinning around and around, consuming your energy and leaving you feeling drained. That drowns out the quiet moments of life. The constant noise of anxiety makes it hard to appreciate the simple things, to find joy in everyday moments, or to simply relax and be present. From the outside, someone with GAD might just seem stressed. They might appear to be functioning normally, going to work, taking care of their responsibilities, and interacting with others. Inside, it's a mental marathon with no finish line. The constant worrying takes a toll, leading to fatigue, irritability, and difficulty concentrating. The mind is always scanning for the next catastrophe, real or imagined, anticipating the worst possible outcome in every situation, and it spills over into every part of life, affecting relationships, work, sleep, and overall well-being. GAD isn't just being a worrywart. It's a persistent and pervasive condition that significantly impacts daily functioning. It's a full-time job with no breaks, demanding constant attention and mental energy. But here's the hope. The worry machine can be quieted. It is possible to regain control and find peace of mind. There are ways to turn down the volume and reclaim your life. Effective treatments and coping strategies are available. So, let's dive in. What is GAD really? Where does it come from? What are the underlying causes and contributing factors? And how can you find relief? What are the treatment options and self-help strategies that can help you manage your anxiety and live a more fulfilling life? Let's open up the hood on this complex but manageable condition and explore the inner workings of GAD. Generalized anxiety disorder is chronic, excessive, and uncontrollable worry about a wide range of things. It's not just nerves before a big event, it's anxiety about everything, all the time, even when nothing's wrong. Most people have a worry thermostat that turns off. With GAD, it's stuck on high. This means living in constant anticipation of disaster, which is exhausting. To be diagnosed, the worry must last at least 6 months and interfere with daily life. GAD isn't a character flaw or a lack of willpower, it's a real medical condition rooted in biology and environment. You can't just snap out of it any more than someone with asthma can just breathe better. Understanding this is the first step toward getting help. Where does GAD come from? What are the underlying factors that contribute to its development? It's a question many people with GAD and their loved ones often ask. Understanding the origins of GAD can be a crucial step in managing and overcoming it. It's a mix of genetics, brain chemistry, and life experiences. These three elements intertwine in complex ways to shape an individual's susceptibility to generalized anxiety disorder. It's rarely just one factor at play. Anxiety often runs in families, suggesting a genetic component, but there's no single anxiety gene, no simple on-off switch. It's a complex blueprint. Multiple genes likely interact, each contributing a small piece to the overall puzzle. Brain chemistry plays a role too. The intricate network of neurotransmitters and brain regions is deeply involved in regulating emotions, including anxiety. Neurotransmitters like serotonin and GABA help regulate mood and calm the brain, acting as natural brakes on anxiety. But in GAD, these systems can misfire, leading to an imbalance that fuels anxiety symptoms. The amygdala, the brain's fear center, is responsible for processing threats and triggering the fight-or-flight response. Can be overactive, keeping you on edge, constantly scanning for potential dangers, even when there are none. Life experiences matter. The events we go through, especially during childhood, can have a profound impact on our mental health. Trauma, particularly early in life, can significantly increase the risk of developing anxiety disorders. Chronic stress, ongoing and unrelenting pressure, can also wear down the brain's natural resilience and make it more vulnerable to anxiety. Or growing up in unpredictable environments can prime the brain for anxiety, teaching it to be constantly on alert. Even personality traits, like being naturally cautious or pessimistic, can increase vulnerability, making some individuals more prone to worry and apprehension. It's the perfect storm, a confluence of factors that come together to create the conditions for GAD to develop. Your genetic wiring meets your life story, shaping your individual experience with anxiety. No two people have the same recipe. The exact combination of genes, brain chemistry, and life experiences is unique to each person, which is why GAD looks different for everyone. The specific symptoms, triggers, and coping mechanisms can vary widely, but knowing the causes helps us understand it's not your fault. It's not a personal failing or a sign of weakness, but rather a complex interplay of factors beyond your control, and it means there are many ways to address it. Understanding the multifaceted nature of GAD opens up a range of potential treatment options and strategies for managing symptoms. Let's look at what GAD actually feels like. GAD is more than just worry, it's a full-body experience. Mentally, it's endless what-ifs, making concentration and decision-making nearly impossible. Irritability is common. Small annoyances feel overwhelming when you're always on edge. It's like having 100 browser tabs open in your mind, all demanding attention. Physically, the body pays the price: muscle tension, headaches, restlessness, and fatigue. Sleep is often disrupted, worries ramp up at night, making it hard to fall or stay asleep. Stomach issues, sweating, trembling, and a racing heart are also common. The mind and body are deeply connected, anxiety in one spills into the other. GAD can make even simple tasks feel monumental, but these symptoms are treatable. Let's talk about how. The best news: GAD is highly treatable. The main tools are therapy, medication, and lifestyle changes, tailored to each person. Cognitive behavioral therapy, CBT, is the gold standard. It helps you challenge anxious thoughts and change your reactions. Instead of avoiding worries, you learn to face them and see that the worst rarely happens. Medications like SSRIs and SNRIs can help regulate brain chemistry and ease symptoms. Sometimes short-term medications are used, but with caution. Finding the right treatment can take time, and that's normal. The key is to reach out and take that first step. Recovery starts with asking for help. When dealing with generalized anxiety disorder, or GAD, it's important to remember that you're not alone, and there are strategies that can help you manage your symptoms. Alongside professional help, which is often a cornerstone of effective treatment, self-care is a powerful tool for managing GAD. It's about taking proactive steps to nurture your mental and emotional well-being. Build your personal toolkit, a collection of strategies and activities that you can turn to when anxiety starts to creep in. This toolkit should include relaxation techniques such as progressive muscle relaxation or guided imagery, which can help calm your nervous system. Exercise in any form is a fantastic way to release pent-up tension and improve your overall mood. Find an activity you enjoy, whether it's dancing, swimming, or simply going for a walk. Incorporate healthy habits into your daily routine. These habits can act as a buffer against anxiety, making you more resilient in the face of stress and connection. Nurturing your relationships and spending time with loved ones can provide a sense of belonging and support. Deep breathing exercises like box breathing or diaphragmatic breathing and mindfulness meditation, where you focus on the present moment without judgment, can calm the body's stress response, bringing you back to a state of equilibrium. Even a brisk walk outdoors, surrounded by nature, can burn off nervous energy and boost mood, thanks to the release of endorphins. Limit caffeine and alcohol, as these substances can exacerbate anxiety symptoms. Eat balanced meals, rich in nutrients, to keep your blood sugar levels stable and prevent mood swings. And keep a regular sleep schedule, aiming for 7-9 hours of quality sleep each night. Create a calming bedtime routine, a sequence of relaxing activities that signal to your body that it's time to wind down. Turn off screens at least an hour before bed, keep your room dark and quiet, and consider using white noise to block out distracting sounds. Connection matters. Reach out and engage with others. Talk to friends, family, or other trusted individuals about what you're experiencing. Join a support group, either in person or online, to connect with others who understand what you're going through. Or simply share your worries out loud. Sometimes just voicing your concerns can help to diminish their power. You're not alone, remember that. Others understand what you're going through, and there's strength in shared experience. Self-care isn't a cure, It's not a magic bullet that will instantly eliminate your anxiety. But it's a vital part of a comprehensive approach to managing GAD. It's about building resilience, fostering a sense of inner peace and feeling grounded and in control even when anxiety tries to take over. Keep experimenting to find what works for you. What helps one person might not be as effective for another. Every small step counts, and consistency is key. Let's wrap up with a message of hope. You have the power to manage your anxiety and live a fulfilling life. GAD can feel like a relentless storm, but it's not a life sentence. The brain can change. Therapy and self-care can rewire those anxious pathways. Recovery isn't about never worrying again, it's about learning to navigate the waves. You become the skilled sailor, steering through storms instead of being swept away. Help is available, and it works. If you see yourself in this story, reaching out is the bravest first step. Talk to a doctor, find a therapist, or confide in a friend. The world is bigger and brighter than anxiety lets you believe. There is quiet to be found and joy to be had. You are not alone. There's a whole world waiting for you beyond the worry.